Okay, next we'll be moving on to understanding living donor kidney transplantation with Dr. Paula Neves. Dr. Paula Neves is the lead of the Center for Living Organ Donation, founded by UHN Transplant, now the Ajmera Transplant Center in 2018, to increase access to living organ donation for people in need of a life-saving kidney or liver transplant and those who want to give a transformative gift of life. The center raises awareness through presentations and webinars, a newsletter, a strong online presence, and events such as Living Donation Week, that's taking place very soon, September 12th through 18th of this year, hashtag LDW 2021. It also provides information and referral education and peer support to living donors, recipients, and caregivers during their donation and transplant journey. In addition, the center partners with researchers and organizations to address financial and other barriers to living donor transplantations, most recently helping to create the CST Living Donor Circle of Excellence, working with patient partners to launch a new YouTube channel promoting organ health in the African, Caribbean, and Black communities, and sponsoring a study on socioeconomic disparities in liver transplantation. Paula has completed a PhD in health policy, management, and evaluation at the University of Toronto. She holds a Master of Public Administration from Queen's University and undergraduate degrees in arts and social work from the University of Manitoba. She serves on several volunteer boards and committees, including the boards of the Christie Gardens Foundation and Hope Air. A very busy woman who we're so thankful to have join us today to speak about understanding liver donor and kidney transplantation. Dr. Neves, I'll throw it away to you.
Thank you. Good morning. My name is Paula Neves, and I'm the lead for the Center for Living Organ Donation at UHN. I'm very pleased to be here today to talk about living kidney donation and transplantation and to answer your questions. Before we get started, let me tell you a little bit about our center. We were founded by UHN Transplant in 2018, and our mission is to improve access to living organ donation and transplantation. We're located within the Ajmera Transplant Center at Toronto General Hospital. And the Ajmera Transplant Center is the largest transplant center in Canada and one of the top 3 transplant research centers in the world. My team advances living donation and amplifies the voices of transplant community members wherever they are. Everything we do is informed by living donors, by recipients, by caregivers, by clinicians, by community partners. And these are some of the people involved in our work. We have 3 core priorities. We provide support to people exploring living donation, and this support can take the form of information and referral, peer support. That is, we connect them with people who've walked the transplant journey. And we also do advocacy. For example, we were a founding partner in the Canadian Society of Transplantation Living Donation Circle of Excellence, which seeks to remove financial barriers to living donation. One of the main things that we do is education. We offer education in the form of webinars. We have a regular Tuesday series which addresses topics like living kidney donation and transplantation, living liver donation and transplantation, how to find a living donor, resources available. We also do topical webinars. Before COVID, we used to do a lot of community outreach, community presentations. A lot of that work has moved online. And so we have a very active social media channels and are very, very involved in promoting public awareness. We organize the annual Living Donation Week campaign, and we also conduct professional education, which is incredibly important to ensure that patients are cared for appropriately and are referred to transplant in a timely manner. We also support applied research. So we've partnered with Dr. Istvan Mucci and Dr. Jag Gill on the Action Project that aims to address inequities in access to living kidney donation in the South Asian communities in BC and in the African, Caribbean, and Black communities in Ontario. Later this month, we will be hosting a national pitch competition for projects that advance our understanding of living donation and support for living donors. And you can get more information on the pitch competition and other events at livingdonationweek.ca. All right, so here's the agenda for today. We're going to talk about living kidney transplantation, why it matters, and the process that is typically followed. We're also going to be talking about the living donor assessment process. I'll be covering a few tips to help you find a living donor if that is something that you are interested in. And I will also talk about useful resources that you will be able to access. So when we think about living kidney donation and transplantation, we think about some of the barriers that may prevent community members, patients, living donors from truly exploring this topic. In terms of patients, often transplant knowledge, knowledge about living kidney donation and the evaluation process are barriers. There's misconceptions about eligibility regarding kidney transplant and living kidney transplant. And many find the process lengthy, burdensome, confusing. There's difficulty in completing tests and appointments. There's lots of concerns. And importantly, there's also areas that are a bit more difficult to address. And those relate to how we feel about sharing information about health and our own health status, and about talking about the need for a kidney. Often we hear that transplant candidates feel undeserving of a living donor kidney. There's a lot of guilt and anxiety about putting the health of another person at risk. And so all of these need to be overcome. And I will try to provide some information today that will help to address some of them. So let's start with treatment options for end-stage kidney disease. These treatment options are often explored in the community. We know that dialysis is an option, and many people on dialysis are unaware that transplant may be an option for them. So this is difficult because there are clear differences in terms of outcomes for people with kidney disease who require treatment. And we see some of these differences on this slide. Now, kidney transplant may not be the best option for everyone. There are criteria that need to be followed in order to be referred for a transplant assessment. And that transplant assessment may pinpoint specific risks that make patients ineligible for transplant. But the transplant assessment can also look at potential benefits for patients and provide information that will allow patients then to make an informed choice based on their own personal values and their own goals of care. It's important to note that these criteria do not exclude older patients. There is no age limit to receive a transplant. Overall health of the person with kidney disease is much more important. So when should patients be referred for a transplant evaluation? Here's the guidance in Ontario. So if they're currently on dialysis or if they require renal replacement therapy within the next 12 months. If they have a living donor and they meet these thresholds, it is also important that they consider a transplant evaluation because they may receive a transplant and avoid the need to go on dialysis altogether. So it's important that patients and families know that there are criteria for referral for transplant. And just because you're referred does not mean that the choice is made for you. It means you will have more information in order to make the choice for yourself regarding what is right for you. We hear that many patients are confused about whether or not they're on the transplant list. And in fact, many patients who are on dialysis think that they're on the transplant list and they're not. We know that that transplant has the best outcomes, but only 12% of dialysis patients in Canada are on the wait list for a transplant. And this compares to 17% in the US. And both these numbers are well below what experts would expect. And we also know that for certain communities, the likelihood of completing a kidney transplant evaluation within 2 years of referral is lower. So this is very, very concerning. Now, a transplant evaluation has two components. There's the component that goes along with referral, where there are a number of tests to determine if you meet the criteria for referral to transplant. And then there are tests that are conducted in the transplant center that will assess whether a patient is suitable for transplant. And both of these can take quite a bit of time. There are many phases. So for example, once you are referred to transplant, to UHN for transplant assessment, there are a number of tests, a number of phases. The team will ultimately give you one of 4 possible decisions. It's too early for you for transplant. It's too risky for you to have a transplant. You are suitable for a deceased donor transplant, or you are suitable for a living donor transplant as well. So once those decisions or that decision is communicated, we hear a lot about the wait. And it's a very long wait. There's waits for the living donor to be assessed, for the deceased donor organ to become available. And where there is, you don't have a match or you're not a match with your living donor candidate, or you have other issues that make you less likely to attract a deceased donor organ that matches your needs, it will take longer. So the pathways to kidney transplantation are two. Essentially, you can go down the route of a deceased donor transplantation or a living donor transplantation. As a living donor, you can make a direct donation to someone who you're related to, or to someone who you're compatible with, or even to someone who may be incompatible. There are ways of donating to a recipient that may be incompatible. Or you can make an indirect donation, either anonymously or through the paired kidney exchange, or something called the list exchange, where you donate to the person highest on the deceased donor list, and your recipient will receive an organ on the list as well. So when we talk about weights, this is what we're talking about. In Ontario, there are over 1,000 Ontarians waiting for a kidney transplant. And the wait times and the numbers of people waiting depend or vary greatly by blood group and by sex of the recipient as well. The estimated wait time can be many, many years, and maybe lower if you choose to accept extended criteria donors who may have some clinical conditions that could be treated or that may slightly impact the quality of the graft, but are safe to transplant. So why consider a living donor kidney transplantation? First of all, there's a much shorter wait, typically a year, although that can vary quite a lot. You can avoid or reduce time on dialysis. And it is also associated with better outcomes. So faster recovery, lower chance of rejection, longer lasting graft, and certainly better health and better long-term survival. Many people also really value the fact that it is less disruptive to family, to work, to social life, and improved quality of life is very important. And finally, there are groups of patients who may be at higher risk and for whom living donor kidney transplantation and the higher quality of the organ may produce better outcomes. So I mentioned earlier that there are ways of donating and being matched with a living donor where if you're not a direct match to your intended recipient. And one of those ways is through the Paired Kidney Exchange Program, which is run by Canadian Blood Services. You do not have to travel to donate a kidney, and you do not have to be on dialysis to participate in the program. And it is important to note, though, that paired kidney donations are anonymous. There are also other initiatives to increase referrals to transplant and assessment. And these are some projects that are currently underway. So the message that I want to leave you with is that every patient who receives a kidney transplant from a living donor comes off the wait list for an organ for a deceased donor. And this means a shorter wait time for the other patients on the transplant list. So the living donor transplant not only benefits the recipient, it benefits everyone else on the list. Let's now talk about the living donor assessment, living donors and the assessment process. So here's a profile of living donors at UHN. These are kidney donors. The age is typically around 44. Most are female, most are married, most are employed. The donor relationship to the recipient is interesting to take a look at. So 1 in 5 are first-degree relatives. Well, 1 in 3 are spouses or partners. And 16% are anonymous or non-directed donors. So a significant proportion. But there's also this large group of other friends, relatives, colleagues. And that's important to keep in mind as you consider your search for a living donor. So we get a lot of questions about why living donors donate. How could they put their lives and their health at risk by donating a kidney or a part of their liver? And certainly many of them donate because they have a personal connection to transplant. So someone that they know may have had a transplant, may need a transplant, some connection to healthcare as well. A lot of them talk about wanting to help and doing something meaningful, appreciating their own good health, wanting to give back, wanting to save a life and give the gift of life. So many, many reasons why they donate. And this is something that they value and that is really important in their lives. And when we look at qualitative research conducted with living donors, we know that many of them talk about how the decision was easy for them. Some aspects were difficult, and those tended to be aspects around how to communicate either with the intended recipient who may be resistant to receiving a living kidney donation, or to family members, for example, who may not understand their decision to pursue living donation. Many also talk about being less fearful and being more confident and more open to new experiences. And some talk about some of the challenges that are involved. Obviously, it's a very time-consuming process, and it's also a process that requires recovery from surgery. And so donors receive some of the out-of-pocket expenses, but they're not fully reimbursed for all expenses. And that has an impact on them. And that is something that we are trying to address. So who can be a living kidney donor? Generally, people who are in good health and who are also in good mental health. It's important that you have a good support system, because you will need to have time off for tests before your donation, and you'll need to have time off for surgery and for recovery after donation. And it's important also that this be an independent decision. And so the social work team in particular pays particular attention to ensuring that this is an informed decision, that the living donor candidate has carefully weighed all of the information and made an independent decision and an informed decision, and that there is no desire for monetary or other compensation. There's a lot of discussion whenever we talk about living kidney donation about blood type. Does it matter? Does blood match matters? It matters, but not necessarily in terms of your search for a living donor, because there are options for matching your living donor to someone else, and you being matched with the other person's living donor. And so we recommend that that you're aware that this will be taken into account, but that you don't necessarily need to take it into account in the search. I should say, though, that paired kidney donation is quite a complex undertaking, and there is a longer wait time for those who enter the program. But it may be an option for those who have a willing living donor, and that person is not a blood match, and there's no other way through other programs currently in place that you could receive a kidney from that person. So the living donor assessment process is also lengthy. It involves submitting a medical history form that is quite comprehensive, identifying blood type to enable the living donor coordinator to make some initial decisions regarding if there's multiple candidates, who to assess first, for example. It also involves a lot of testing, diagnostics, consultations, etc. So this process, as I said, can take quite a while. And post-surgery, there's also a recovery process. So donors will typically be in hospital for 5 days, 3 to 5 days. They will have to come back and see the surgeon within a month. They will also do additional blood work in the first 3 months, and after 6 months, we'll do additional blood work. And if everything is okay, they will be followed by their family physician on an annual basis. And it is important that donors get consistent primary care. Donors lives monitor donors for the first 6 months, and they recommend that their providers track them annually for preventive care. They are screened carefully, but only 1 in 5 at UHN it actually follows through with donation, and that is because often other health concerns, other issues are uncovered during the assessment process. It's important for you to know that the living donor team is independent of the recipient team. And the donor team must be satisfied that the donor is making a voluntary and informed choice. The donor assessment process itself is confidential, and donors can gather information and be assessed, but they can withdraw at any time, and their decision will be respected, and their privacy and the confidentiality of the discussions will be respected. So the process starts with interested candidates submitting a medical history form along with a copy of the blood donor card to the living kidney donor office. The risks of living kidney donation are fairly low, but they are not zero. And so these risks will be discussed in great detail during the assessment process. And it is important for patients, prospective recipients looking for a donor to be clear that there are risks, but not necessarily take on the task, which could be quite overwhelming, of explaining all of those risks. Those risks are better explained by the living donor team, and they should reflect the status, the health status of the living donor candidate. So it's important to address, but please rest assured that the transplant teams will discuss these risks in great detail with and answer any questions that the living donor candidate has. And it is important to minimize long-term complications by having regular preventive care. And I thought this quote was very interesting from a living kidney donor, and I think is important probably for many of us, that we have regular follow-up to ensure that we receive good preventive care. So an important reminder, transplant centers will only begin assessing living donor candidates once they have a referral and you are listed or deemed eligible for transplant. The donor assessment can be lengthy, so if you are looking for a living donor, start exploring early. And also be mindful that many living donor candidates go through the process and are unable to donate. And so it may be helpful to have several candidates move forward. In Ontario, only one candidate is assessed at a time, but there will be options for you in case the initial candidate is unable to donate. So now on to the next section, which is 5 tips to find a living donor. So tip number 1, and this is really, really important, and that is know that you are not alone, that many have walked the path of living donation and transplantation and are eager to help you and are eager to answer your questions. So living kidney donation is actually more common than you think. Every year, 100,000 kidney transplants are performed in WHO member countries, and 1/3 of them are made possible by living donors. So that means there are many, many living donors in Canada and elsewhere who are able to answer your questions, who have a shared experience, and who can help inform your decision or address your questions, in addition to the transplant teams. And here's an example of one such person. This is Harvey Mizell. He is a 2-time kidney transplant recipient, and he started a not-for-profit and developed a program called having your donor find you. This is a free program. The PKD Foundation is a partner in an effort to Canadianize the program. So you will have access to this program, and it is free of charge. It provides very, very helpful information about how to have a conversation about living donation. And Harvey's key message is you don't have to ask anyone for a kidney. If you are bringing your friends, your family, your networks along on your journey, they will understand your need for a kidney, and there will be some among them that will step forward on their own to be tested and to support you. That is an incredibly important message that I want to leave with you today. There's also supports that have been developed by organizations. So in BC, for example, they have a policy of transplant first. And BC Transplant has on their website a lot of useful resources, including a guide to finding a donor and getting the word out. And this guide is available in several languages. Additionally, there are groups of living donors and recipients who may be a good source of support. And we know that sometimes misinformation does spread in groups. This particular Facebook group that you see on your screen is co-moderated by two members of our volunteer advisory committee. It includes members from across Canada, and they may be a good source of information on kidney donation, kidney transplantation, living donation for you and your family. Similarly, the Transplant Ambassador Program provides a lot of support in dialysis and kidney clinics. They have peer educators that are able to provide confidential support and information to you. So if you're interested in getting a perspective of someone who's been through it, the Transplant Ambassador Program, which will be expanding to centers across Ontario, is a source of support for you. My second tip is learn with family and friends. The more informed everyone is, the better your chances of finding a donor. And when I talk about learn, we can certainly talk about some sessions that are delivered by transplant centers or by our centers. So for example, we've got education sessions, we've got webinars, but I would also encourage you to think about learning from the perspective of sharing information that is widely available or that may be available at certain times of the year. So for example, Living Donation Week is coming up, and there will be a lot of information on social media. There will be a lot of information, hopefully, on regular media about this event. And I would encourage you to share just the link even to Living Donation Week or some key messages that come out of our partners in this event, because that gets the conversation started about the value of living organ donation. These are some of our social media channels. Not everyone is able to be on social media, so we also have a newsletter. So tons of support. This is good information for you, for your family, for your networks, and to share and to encourage others to share and get and find out more. So my third tip is to begin to share your story. And I know that for some, this is very, very difficult. But I want to reassure you that it is an opportunity for you to also receive support. And you may want to start with your inner circle and share what feels comfortable. So who is in your network? We tend to only talk about family or friends, but certainly there are other people in your network, and all of those other people have people in their own networks. And so the more information you share, the more linkages, connections you make, and the greater the likelihood that if no one steps forward from within your immediate circle or is able to donate from within your immediate circle, then there are others in the broader community that are aware that that you have a need, or that of your story. And so this is an example of how how someone might be able to start the conversation. This is a sample email that could be sent out, for example, which just provides an update on what's happening with your health, and some of the information that the transplant center may have communicated to you. And all you're doing is just sharing that information. If you want to go the next step, writing family and friends, talking a little bit more in more detail about your situation, and about options for treatment, and about living donation, and even providing the contact information for a transplant center. Here's an example that is shared on the BC Transplant website. This letter or this email is developed for those who are a bit more comfortable sharing more information, going a bit broader in terms of their network. And the one thing that I would say is, please confirm with your transplant center the contact information that you're including in any kind of messaging that you give out, whether it's you're broadcasting it to the broader community or you're sharing it with a smaller network. Because there are sites where you can find information broadly about living organ donation. But if you're going to include phone numbers and email addresses, ensure that the team, the transplant team, is able to address any requests for information that come forward. And if your contacts are just exploring living organ donation, some of the information that we provide may be helpful to them in that initial exploratory phase. So how will you share your story? We've talked about emails, we've talked about conversations, social networks, public appeals. All of these are get the information out to a broader circle. And obviously there are a number of considerations. And one of them is privacy, yours and others involved in your story. So it's very important for you to think about what you would like to share and are comfortable sharing, because that stays out there, and so it is part of the consideration. It's also important when you're sharing your story or when you're sharing the need for a living donor that you that there is any unclear or misleading information potentially about living kidney donation. It is a very low risk procedure, but the risk is slight, and it's there. And so it's important that donors make an informed decision. You don't need to communicate all the risks or any of the risks, but don't tell your group that there is no risk, because that would be misleading those who may be stepping forward. And also, at the end of the day, it needs to be an informed donor decision. The donor needs to and should be encouraged to look at a variety of sources, to really consider the information, and to come to a decision on their own in collaboration with their teams that will be assessing their health status, and also contributing to that decision. And the other thing is support required. So if you're looking to go broader and more public, you may need people who know how to manage a website, know how to post things on social media. So all of that means that you will need to find champions, people who can advocate on your behalf, who can share information on your behalf. And here's an example of a champion in the workplace. Again, it is very important not to be coercive in any of the language that's used, but it is okay to share information that is just about the situation, the need, and potentially a website where people can find more information and explore a living donation for themselves. So not all people can be living donors, but all of your contacts, all of your networks can be advocates. And many are more than happy to do that. They can help spread your message. They can alleviate pressure on you to find a living donor. They can begin by starting the conversation, by spreading awareness of living donation, by managing outreach campaigns, and also by providing emotional support as you go through the steps. So I think that donors are very important in the process, but champions are equally important. They may, for a variety of reasons, not be able to donate, but they are crucial to the transplant journey, and there are crucial supports both for transplant recipients. And here's an example of someone whose champion was able to spread awareness and enable someone who was interested to step forward and become a living donor. So this is Claudia. She has shared her story in a number of our events. Her youth minister made a social media video that was shared across the globe, and Julia found Claudia and became her donor. Claudia shared her story last year during Living Donation Week in a session on faith communities and living organ donation. So I would encourage you to check it out because it is very inspiring. And that recording also includes a recording of the video that Claudia's youth minister developed, which is very well done and clearly done with a team, and certainly that took a lot of time. And so donor champions, living donor champions, are quite committed and can be very effective. My final tip is don't wait. Explore treatment options and start your search for a living donor now. I think it's important for you to know that you and your family and friends deserve the healthiest possible you. And there are ways to get started. Today was one, but there are additional resources, supports that are available. And this is a workshop that will take place during Living Donation Week that you may find helpful. It is co-led by Heather Badnock, who is a living liver donor, Candace Coughlin, who is a kidney recipient and new mom, and Harvey Meisel, who I spoke about earlier, who is the who received a kidney transplant twice. So he and Heather and Candace will be leading those who register through a very practical session that will give you tips, that will show you examples, and that will help you to begin to write your story, communicate your story, think about your story. So, how you share it is up to you, but this may be a good way to begin to explore your options. I mentioned recordings that were part of last year's Living Donation Week, and there are other education sessions during Living Donation Week this year as well. But there will be a lot of information on social media, so subscribe, follow, and share all of those messages that you think are relevant to your networks and to your situation. We have some resources to help you as well. We've produced a guide to living organ donation, public appeals, and social media, which go through some of the requirements or some of the things to consider, particularly with respect to privacy and what to share, may be helpful to you. We also offer support. These are some of the supports that we have, and this is how to contact us. So thank you very much for your time and for your attention, and I look forward to your questions.
Thank you, Paula. That was a fantastic presentation, and a very timely one for us. My wife recently, just over a month ago, gave 60% of her liver to her father out in London. So from a family whose mom has been transplanted with 2 liver transplants and will need a kidney, it was interesting to be on the donor side of things for a change in my family. And we very thankfully were able to connect. Courtney, one of your colleagues, connected us with Heather leading up to my wife's surgery. And they've become friends in a mentoring capacity. And Heather was able to walk her through what it was going to be like as a living liver donor, what to expect. And it put my wife at so much ease, even having me around the house and the knowledge that Foundation knows, her medical team, all of that had been fantastic. But to speak with someone who had been in that position was invaluable to her. So I think the work that you're doing, your institute is doing, is absolutely admirable, and such an important piece to generate that interest in living donation, which is really, until presumed consent becomes a more common trait, living donation is the way to reduce that wait time on the list. So that we do have a few questions, Paula, if I may jump right into them. We can continue. You can hear me okay?
Yes, I can.
Wonderful. Well, coincidentally enough, speaking about presumed consent, some provinces have enacted presumed consent, i.e. that deceased people are presumed to consent to donation of their organs unless they opt out ahead of time. Why hasn't Ontario enacted this? And are there ways to lobby the Ontario government to do so?
So I know that this is, there's a lot of interest in this topic. Jurisdictions that have presumed consent in place, in some cases have higher rates of donation, but that's not necessarily consistent. I think that the important thing to remember is only about 2% of deaths occur in such a way as someone is able to donate their organ. And so we will find out whether it has an impact on Nova Scotia. They're leading the way in North America. I think that the biggest part of success in the jurisdictions that have presumed consent is that they've been successful because they've got a very well organized system, so that when somebody expresses a consent, the team is actually able to follow through and ensure that those wishes are honored. So it's important. We will see what the impact is, and look forward to learning more.
Yeah, myself included. I know, I mean, we get a lot of questions within the PKD community about that, as I'm sure you do. So I think we all look forward with bated breath to see what the results of the first few years are in those areas that have aligned presumed consent. Our next question, I'm surprised by a BMI of 35 constituting a healthy weight for a donor. Knowing the long-term attendant risk of overweight on CV and kidney disease, as well as the attendant operative risk, are there prospective donors helped to lose weight?
Yeah, so when I mentioned, or when you saw the BMI of 35, that is absolute contraindication. So if you have a BMI at that level, you will not even be considered, your medical history form will not be reviewed. However, we do have quite a number of living donors that are very motivated to donate. And so often they take the time to lose weight. It takes a while. We want to ensure that they do it safely. You know, some of those donors are successful in losing weight and then able to donate. There is, we do track, you know, we do have people, despite best efforts, that will not be able to donate because of BMI. So we aim for healthy weight, you know, much below that in the normal range, but certainly, you know, when somebody is a candidate, they're, you know, and they're very motivated, sometimes they're able to successfully lose the weight and demonstrate lifestyle changes that will enable them to keep the weight off after surgery, which is also important.
Thank you. The next question, can you say more about at what point, example, GFR level, rate of decline, patient should start the process of looking for a living donor? Also, do you wait until the patient has completed their own transplant evaluation or in parallel?
I think the search, and what I hope to communicate today, is that where there's a possibility that you may need a transplant, it's you know, it's important to bring your networks along on your journey, so that if and when you need a transplant, it's not a, you know, there is already a group that may be thinking about stepping forward and may be able to step forward. I think that in terms of when to actually submit a history form, a health history form, etc., the team, our team, we sometimes get living donors stepping forward to donate to a specific recipient, but the recipient hasn't actually been referred to us yet. So we cannot start the assessment of that recipient until we, or of that donor, until we receive the referral for the recipient. In terms of when that referral happens, I did share the referral criteria, and Jeff, maybe that's something that can be posted on your website, a link to the Trillium referral criteria, so that patients can advocate on their own behalf.
Absolutely. Much like the area where we have Find Your Living Donor, we can certainly put that information up. Anything to close the gaps, you certainly can. Yeah. Next question here. We have two more questions. If my GFR is 30, can willing donors be tested now, or do we have to wait until less than 15 GFR to be referred to the team?
I think you know, the answer that I just gave probably addresses this. Again, in order for your living donor to be, you know, to start being tested, it's important that we receive the referral for you first. But that doesn't mean that the living donor cannot begin exploring what the process looks like, cannot begin to talk to others who've donated, so that they're feeling a bit more comfortable. And, you know, we talked about BMI earlier. It may be that they want to get in shape, or that they want to lose weight. We're actually going right now, developing a program that will hopefully assist candidates who want to donate to ensure that they have good, healthy lifestyle practices, that they're in the best shape possible. Because you know, the healthier, better shape they are going into surgery, the quicker the recovery. And so, you know, it's never too early to start, but to bring people along on your journey, but the actual process of assessing a donor really depends on, you know, the outcomes of your own referral.
Right, understood. Last question. Great presentation, Paula. Would you be able to share some of the resources you highlighted in your presentation so that patients and families could have a tool to build off and personalize? So this kind of speaks to what you shared about Harvey's program, Finding Your Living Donor, that breaks it down step by step for how people can get started with their campaign. Would that be the best point of reference on your site as well?
Yes, we're just developing, we're going to be developing some tools that will enable you to begin to think about your story, to document your story. for some, it's very difficult. I know that, I know that I have this in my own sort of life, in my own family, where it's very difficult to share our stories. So I think that we're going to develop a series of tools that will assist you. We are working on improving our site so that it's a bit easier to find this information, but I would encourage you to start with Harvey's videos and program, and to attend our Finding a Living Donor workshop. It's free. We're not recording it because we want anyone who attends and has questions that are personal in nature to be able to share it. And so, those are two ways. And then, Jeff, I'll follow up and maybe send you a list of resources that you could circulate to participants.
Certainly, we can send that along with the recordings of these presentations after the fact. But the best way, I mean, newsletters, our organizations work and operate the same. Staying connected with our newsletters, liking social media, following our social accounts and your accounts, they're the best way to stay connected and to know what's coming down the pipeline, because there are so many great free resources out there. At times can be hard to keep track of them all, but if you're following the accounts, it's the best way to stay connected.
Yeah, absolutely.
Well, that concludes the question and answer period. Thank you so much, Dr. Neves, for taking your time to do this presentation. I know it's been a very well thought out, informative presentation, and we look forward to your event coming down the pipeline later this month.
Thank you very much for the invitation, Jeff. This is very exciting, and luck with the rest of your event.
Thank you so much. All the best. Bye-bye.